Can you explain?
Eric, can you squeeze that? Thank you.
Can you please tell us when you got the call and what was said to you specifically from the governor?
A few days ago. And I was asked if I would come in to serve in a temporary capacity as acting secretary.
And what do you think your first steps are going to be now that you're taking that role?
I think there's really two. One gets to this last question about morale and culture. I see it as a big part of my job to work on making sure that people feel heard and that we have a culture within the Secretariat that is providing adequate leadership and support to the staff. Two is to work hand in hand with Eric as he holds our vendor to fixing the system. I need to make sure that the arms of the agency that come into contact with the system that use it to serve so many hundreds of thousands of Rhode Islanders are working as effectively and as efficiently as possible, and so that the human element that interfaces with the system is as effective as possible.
Eric, you said you're going to...
Well, I was actually going to add to the governor's response to your question about employee morale. As part of this assessment period, I went to all of the field offices and talked to as many employees as possible. And there's no question that there's a high level of frustration. But one thing that left me with a sense of optimism is that everyone who works at DHS, who interacts directly with these clients, cares deeply about public service and wants very much to be able to help the people in front of them. And my view is that the employees are going to lead us out of this. I'm optimistic that if we're working together, that we will see improvements to the system and we will get through the backlog and deliver the customer service that Rhode Islanders deserve.
You say you're going to improve outreach to clients through a variety of platforms. Can you give me some examples of ways you might do that? People who have been waiting, people who have gone without. How are you reaching out to them and making it right?
So I started with the tour of each of the field offices, as I mentioned, also did an anonymous survey for the staff. We're going to create an online suggestion box, not only at DHS, but also at the other agencies, UHIP and HSRI, so that people can lead feedback. And I'm going to continue going around and doing a listening tour. I think that one lesson in this is that there's room to improve communications and to make sure that we're hearing directly from stakeholders, from employees, from customers, and that those views are heard and represented at the decision-making table when we're setting priorities about how to move this project forward.
Eric, if I call up Deloitte today and I get them on the phone, what should I ask them? How could you guys not do this? What did you guys do here? What's the top of the list? You sound that they were pretty egregious.
You should ask them to confirm their commitment to giving us whatever resources are necessary to make market improvement as quickly as possible on this project. We have that commitment from them. They're willing to sit down with us to renegotiate the terms of the contract so that our payments are linked to performance. But that's what I would ask.
But you did the autopsy. You know better than we do what mistakes they made. What should I say? Hey, Eric says you guys did this wrong.
I said it as plainly as I could in the report, that the system isn't working. And if I had to tell you the thing that I heard most frequently when talking to staff and to stakeholders, that was the sentence. The system isn't working.
For the people who hear the news today and tonight, who are affected directly by this, and says it's going to take 12 plus months for it to be fixed, hopefully, are these people going to not be with their benefits, their food stamps, their SNAP benefits for 12 months? I think that is one of their top concerns.
We are going to approach this with a heightened sense of urgency, and we are going to hold people accountable for making steps to improve it week by week, month by month. We just want to set realistic expectations because I'm not sure that we did that effectively at the start of this project. And we want people to understand that after we get through 2 to 3 months of an IT turnaround where we fix a lot of the glitches and some of the portals are functional, then there are some deeper problems with the user interfaces, with the processing time for cases, underlying data issues that go back to the conversion that are going to take a longer period of time. And I have to trust Ken Brendamore, who's on board as the IT project executive here, and others who say that some of those changes are not things that you can promise in the near term. Those are changes that will take 6 months, a year. So we want to be as transparent as we can be about what the path forward looks like.
Mr. Beane, can you talk a little bit about any discussion you've already had with the Federal Nutrition, Food and Services, they were the ones that said, don't go live. They were the ones that said, we want a corrective action plan. There's already been a action plan to the corrective action plan, and now this. Have they been briefed, and have they responded in favor or not in favor so far?
I have had a number of conversations with them. That was one of my first conversations after accepting this assignment. They were very candid and concise in laying out their top concerns. I made note of them, and I made sure to bring it up with other leaders on the team. Just last week, as the governor referenced, we met with senior officials from the regional office and from DC. We acknowledged the mistakes in the past. We acknowledged that their concerns were validated based on the events after the go-live period, and we expressed an openness and a willingness and a hope that we could work collaboratively going forward, that they could help us learn from the lessons in other states that have gone through similar circumstances, and they've also committed to exploring regulatory flexibility in areas where we might be able to process cases more quickly. So I'm hopeful that we'll have a much better relationship going forward.
So this replaces the corrective action plan?
We did submit a formal response to their follow-up questions, and we're going to be meeting again next week in person, so they'll have the opportunity to share their reactions both to the report and the latest document that we filed with them.
Part of it, the problems with UHIP have butted up against a federal court case in which people with developmental disabilities, there are about 3,000 of them, are supposed to receive timely services, and there's a judge getting quarterly updates on that from the bench. And so how would you address any mandates from the court? What would you do with any mandates from the court to provide timely services? Some people have been they applied in August, and there's a mandate for people transitioning from high school to adult services to receive timely services, so they're not sitting at home, and so their parents don't have to put the jobs. And so the person I know keeps track of these things. They applied in August, they got approved in December. So what are you prepared to do if the judge comes calling? So
the first thing I'll say is that we need to face facts about the number of pending applications and how quickly we're going to be able to move through those with current staffing levels. I concluded that the backlog was going to continue to grow, not as sharply as it did in the first 5 months, but was going to continue to grow unless we saw dramatic improvements in the system, and unless with corresponding productivity gains, or if we have more staff. So we're going to do a staffing surge to address that. But timeliness of access to benefits and services is a concern in the particular circumstance that you mentioned, but it's a concern across the board. And unfortunately, timeliness is a problem with each of the programs. And we know how important it is for these families to get access to the benefits. So we are going to attack it with as much urgency as we possibly can, and we're going to deploy all the resources available to try to drive down that backlog as quickly as possible.
I want to ask what the metrics we've been receiving on the backlog, or is that picture also worse than we thought?
I don't think the picture is worse when it comes to the number of pending applications, but we are very focused on getting timely access to accurate information, but we'd like a little more detail in what we're able to pull out from the system. We will, going forward, as it mentions in the report, commit in the beginning of each month to putting out dashboards that show in a visually clear fashion how we're doing program by program on timeliness. So hopefully, not hopefully, we will have that ready in early March.
This question for both of you. I know when we talked yesterday, you said you got more condolences than congratulations when you signed up to help with UHIP. Can you tell me, both of you, why you decided to come on board and help, knowing the massive scope and the amount of problems that needs to be fixed and the lives at stake?
I'll take it first if you want, Anya. My whole career has been in public service, and I have been honored to have the opportunity to work in the governor's office since the first day of this administration on a wide range of issues. But for me, this was an opportunity to dive in and focus on one area that was affecting thousands and thousands of Rhode Islanders who felt let down and frustrated because they didn't have the same access to benefits that they did before. It's a tough challenge. I knew that going in. It wasn't going to be easy to chart a path forward, but there's no assignment that's more important to the state right now than this. So I took on the assignment willingly.
People who are waiting for benefits.
Can Anya answer, please?
Okay, thank you.
Let's make this one the last one.
So, we have to get this right, it matters too much for too many Rhode Islanders. And so fundamentally, I'm motivated by the desire to get it right, but also a commitment to and friendship with a lot of people who've been trying to make up for the shortcomings of the system. And I think they, at this point in time, really need good leadership and solid support to get out of the situation we're in. So, because of their dedication, I feel particularly compelled to step in and try to pull together the right team and give them what they need to be successful.
Thank you.
Thank you very much.
Anya,